Podcasting from the base of Lake Tahoe in the eastern Sierras comes the Medicine Wheel. We are a group of progressive physicians seeking solutions and enlightenment while surfing the seas of big data and summiting mountains of research in an effort to make the practice of medicine more personal and medical knowledge more accessible, and empower you, the listener and viewer, to be as healthy as possible. Now, the Medicine Wheel.
Hello, I'm Dr. Michael Gerber for Medicine Wheel. And today, as we go through the alphabet, we're going to talk about C's in integrative medicine. And there's lots and lots of them. Last time we talked about the king of nutrients, vitamin C, which we are also dependent upon to intake from our foods and environment and supplements. And today we'll look at some other C's. So let's start off with cortisol. Cortisol is hydrocortisone, which is our bioidentical hormone made in the adrenal cortex. The adrenal gland is the pyramid-shaped gland on top of our kidneys. And it is the stress gland. So people who are under lots of environmental stress or infectious disease stress, viruses, parasites, bacteria, fungus, mold, this gland can take a beating. And when the cortisol is low, all sorts of bad things happen, like extreme fatigue, insomnia, anxiety, difficult focus and concentration, brain fog. So many things happen when our cortisol is low. Cortisol is not equally distributed amongst the population. Big people have big glands. So a person who is 6'5", 250 has a huge adrenal and can drink 2 quarts of whiskey a day, although of course he shouldn't. But versus a little 75-year-old, 4'10", 100-pound lady, and who would drink, a half a glass of wine and be sick for several days. So it has to do with our detoxification potential as well. So cortisol or hydrocortisone is bioidentical. It's like what we make. It's not a synthetic hormone like prednisone or dexamethasone or triamcinolone or prednisolone, which are drugs that have adrenal-cortical properties. Back in 1974, William M.C.K. Jeffries wrote a book called The Safe Uses of Cortisone, and he basically reviewed the history of cortisone, hydrocortisone usage, starting in 1948 when enough hydrocortisone was available back at the Mayo Clinic in Rochester, Minnesota, to treat rheumatoid arthritis. And by giving a shot every day of 50 to 100 milligrams of hydrocortisone, they would pop the arthritics out of their wheelchairs in several days. And it was hailed as the biggest miracle in medicine in the 20th century. And then within a few weeks or a month, the patients all start getting Cushingoid, which is moon phases, buffalo hump, thinning of the skin, and immune system suppression, which was the result basically of an overdose of hydrocortisone. So then it got a bad reputation and it became a pariah. And everybody said, don't use that stuff, it'll be very bad for you. So Dr. Jeffries, who is trained in Harvard in endocrinology, wrote the book saying that if you just give 5 milligrams 4 times a day, that people who have chronic fatigue and allergies and autoimmune disease will become healed and live happily ever after. Unless they got a virus or an infection, then he would give 10 milligrams 4 times a day. So it can be used safely in a number of ways. So cortisol is something that many people are deficient in and need a little support, at least in times when they are under great stress. So there are times to use the cortisol and hydrocortisone, and it's inexpensive and can be delivered, many ways. Another C is CoQ10, Coenzyme Q10. CoQ10 is a very important part of the manufacturing of ATP in the Krebs cycle, and it particularly is useful in heart disease and congestive heart failure This was first developed in Japan in the 70s and 80s and has a lot of research behind it. It is notoriously blocked by statin drugs, so even cardiologists these days are recommending CoQ10 supplementation to people who are taking statins. Just in general, anybody with congestive heart failure, arrhythmias, or just the aging heart will find Q10, coenzyme Q10, very helpful, usually at 200 or 300 milligrams a day. Well, cancer is another big C, and of course, in integrative cancer care, as we mentioned last time, vitamin C is very important because tumors have high levels of iron, and vitamin C reacts with the iron in the Fenton reaction to make peroxide, H2O2, which is a very strong oxidant, and so it oxidizes the cancer cells who have poor antioxidant defenses. So Dr. Devlin, who is your host here on Medicine Wheel on many of these podcasts, is our current cancer specialist, and he uses a broad range of all varieties of cancer care, including radiation and chemotherapy. But he prefers to do the chemotherapy after getting a genetic evaluation of tumor tissue by Caris, C-A-R-I-S company in Arizona, and they conduct hundreds of testing on the genetic aspect of the tumors and then find the chemotherapeutic agent which will fill the bill and most effectively kill the tumor. Now, Dr. Devlin, and this practice goes back to 1937, uses IPT, insulin potentiated therapy. So by putting insulin into a patient's vein and dropping the blood sugar down to the 40s and 50s, and normal's 90 to 100, it makes the tumors very hungry because cancers only eat sugar. So by doing a 1/10 dose of the chemotherapy, piggybacked on dextrose, which goes into glucose, the cancers are very hungry as the blood sugar drops, and you can use the 1/10 dose of the chemotherapy very effectively with far fewer side effects and less loss of hair and loss of the intestinal lining. So IPT is a great innovation. Now, mistletoe was developed by Rudolf Steiner in the beginning of the last century, and he also developed anthroposophical medicine and biodynamic farming and Waldorf school, so he's a great German-Austrian genius back in those days. And he observed that mistletoe is a parasite. It grows on other trees, and it has a very funny growth pattern that it grows in the winter and goes dormant in the summer. So he found that various kinds of mistletoe on various trees were good for various types of cancer, pine for one, oak for another, etc. And he first started using it orally, and then it's been used subcutaneously for years, and now in high doses it's used intravenously, and it really increases the killer cells to help kill the tumors. For many years we've done major AutoHemotherapy. This is an old German technique that takes blood out and and runs it past a ultraviolet light, and then ozone is injected into the blood, and it runs back into the body through the ultraviolet light and has a very anti-cancer property. Artemisinin, which is mainly Artemisia, which is wormwood, also is enjoying a renaissance, and it pulls iron out of tumor cells. And iron is, some people have been even receiving iron when they have cancer, which is a very bad idea. So also there's been a Euro-European push to do a 4-part drug therapy that uses doxycycline, metformin, the diabetes remedy, mebendazole, which is an antiparasitical, and atorvastatin, of all things, which is a statin drug. So by combining all these things with traditional surgery and radiation and cyberknife, Dr. Devlin has a great track record in treating recalcitrant cancer patients. Well, another great C is cayenne pepper. And you say, well, cayenne pepper, that's just a spice. But it is a stimulant in the herbal world, and getting herbal-grade cayenne pepper in capsules so that it doesn't become rancid in the straight powder and loses its power, is wonderful for any kind of acute distress, from bleeding to nosebleeds to chest pain to stroke-like symptoms, visual disturbances, seizures, high or low blood pressure, and it is also an anticoagulant. It has coumarins in it, which are kind of like Coumadin, warfarin, which is a common anticoagulant. So cayenne will reverse many types of visual symptoms by the time you count to 10. And same thing, chest pain and angina. While you're waiting for more definitive therapy, it's a great first aid kit. Cayenne pepper. Choline. Phosphatidylcholine is our brain's principal neurotransmitter for memory. And by taking things that stimulate choline synthesis, like acetyl L-carnitine, cytidine 5-diphosphocholene, glycerol phosphocholine in the diet and by supplementation, it really improves memory and helps to restrain the advent of dementia. So we really like to use a lot of choline or phosphatidylcholine to supplement our patients. Well, collagen. Collagen is what makes our connective tissue, and that's what holds our body together. Our arteries are all made out of collagen. So vitamin C, of course, is the great collagen maker. It makes the ground substance of the arteries, the connective tissue of the arteries. And when that is deficient, then the body starts plugging the holes in the dike with calcification and with plaque. So keeping the connective tissue going is very important. So bone broth is a very good way of doing connective tissue support, as is purified gelatin is another very good support. So all of our connective ligaments for backs and necks and shoulders and knees and elbows, it's really important to supplement foods that are high in connective tissue. Clostridium difficile. This is hospital diarrhea. Usually it happens after antibiotics, but it's very, very difficult to control diarrhea, and even many antibiotics don't work on it. However, Saccharomyces boulardii, which is a yeast, has been very effective in controlling C. diff. By taking 2-3 times a day, it's very good. Also of interest, new data is showing that Clostridium difficile and other Clostridium species, which are found in the intestines, of course, inhibit the breakdown of dopamine. And dopamine is the neurotransmitter that's usually associated with hyperactivity and schizophrenia. So by treating the intestines with good probiotics, we can sometimes help psychotic episodes and anxiety from hyper amounts of dopamine in the system. Well, another C is Crataegus oxycanthus, which is hawthornberry. Crataegus is a great herb and a great tonic, especially useful for heart failure, heart arrhythmias, and atrial fib, and premature ventricular contractions when the heart goes thump, bump, thump. And it's a great heart tonic, especially before exercise. And it comes in the tincture, and we use German Nestmann Crataegus. And it's good in all homeopathic dilutions. So, in homeopathy, we dilute by Roman numeral X, powers of 10, C's, powers of 100, M 1,000, LM 50,000. So many times a 30C or a 200C of hawthornberry Crataegus is very, very helpful for heart problems. Chamomile. Chamomile is German chamomile, and this is a homeopathic remedy generally prescribed, and it's a great children's remedy. It's good for obstinate, restless children who stiffen up their body when they're held, have to be held and all the time, or head banging. They need to be held and walked around. It's very good for insomnia. It's actually good for delayed speech and even head banging. So it's very great children's remedy, especially good for little blondies with red cheeks. So chamomile is a priceless remedy for adults, but especially great for children. Another C, Cocculus indicus, which is the Indian cockle. And again, homeopathy is so counterintuitive that I hate to bring it up. It's taken me 30 plus years to understand it. But cocculus is fish poison. And in India and Southeast Asia, they dump this fish poison into the ponds, and the fish lose their neural function and all come flopping to the surface, and they can just net them up and pick them up off the top of the water. One might ask why we would use poison. So homeopathy uses lots of poisons, arsenic and fish and snake venoms. But this venom, this poison, when administered in a diluted form, is really great for motion sickness and dizziness and neurological dysfunction. Another counterintuitive guy that in homeopathy we use a lot is Conium maculatum, which is poison hemlock. This is what they killed Socrates with several thousand years ago. And in the gross form, it's poison and you die from the feet up. But when you use it in the homeopathic form, it's great for weakness and debility and shakiness and instability and aging and cancer and prostate issues and dementia. So Conium mac is one of our frequently used remedies, and so another great one. Well, here's another counterintuitive piece to this, the vitamin, the C puzzle, and it's calcium. Now, for years, we're instructed to give all of our osteoporosis patients calcium, but it turns out that in the book by Thomas Levy, MD, JD, in his book, Death by Calcium, and you can get this online at foxpubmed.com, he finds, with excellent data, that it increases the risk of cancer, dementia, and heart disease. So we have stopped giving extra supplemental calcium and make sure that we give plenty of vitamin K2, which takes calcium out of arteries and puts it into bones, and vitamin D, which also increases the strength and the structure of bones. And of course, we always give magnesium. So a new look at calcium from Dr. Levy and his book, Death by Calcium, and that's foxpubmed.com. And it's well worth reading. Now, another big C word in integrative medicine is chelation therapy. Now, chelation comes from the Greek root, the claw, to grasp or to bind, the crab's claw. So chelation binds things in our body and helps bring them out of the body, and mostly things we don't want, like excessive calcium, for example, in our arteries. Now, the initial chelation was developed by a scientist named Munoz, who worked for IG Farben in Germany, which was the largest chemical manufacturing plant in the world at that time. And they manufactured a lot of the poison gases for Auschwitz and all, so they had quite a reputation. But also they were a leading manufacturer of textile dyes. And they found that if calcium in the water supply got into the textile dyes, the dyes would run and ruin the dye in the dyeing process. So they found that acetic acid, vinegar, would pull calcium out of the solution. So they wanted to be free from imports of calcium before World War II, and this was 1937, that they decided to make a better molecule in the true German fashion. So they made tetraacetic acid, or 4-acetic acid. So that's EDTA, ethylene diamine tetraacetic acid. Well, after World War II, the American generals wanted something to pull radiation out of people, and indeed EDTA worked well if the radiation was attached to a heavy metal like iodine, for example. But what it really worked great for was lead. So, and to this day, EDTA is the premier chelator of lead for people who have lead poisoning. And it's still very common. We do routine screening of hair analysis and look for heavy metals: mercury, lead, cadmium, arsenic, aluminum, tin, nickel, titanium, uranium, antimony. And in our area here in northern Nevada, there's lots of arsenic in various wells, especially north and east of Reno. And arsenic can be pulled out by sulfur molecules like MSM, methylsulfonyl methane, and also arsenic really blocks selenium, so we give methylselenocysteine, so we give selenium and sulfur to help with arsenic poisoning. Arsenic filtration can be a little pricey at the home level, but I think it's really worth it. And everybody remembers the old Broadway show, Arsenic and Old Lace, where the two widow ladies would bring all the old widowers in and feed them tea with arsenic in it, and gradually increase the amount of arsenic until they died, and then get the widowers' insurance. And of course, this was a comedy, but arsenic and old lace. So mercury is also an important one to come out. We always like to think of Flint, Michigan, when they had the big poisoning of lead in their municipal water and all the kids. And you really didn't hear much about EDTA chelation at that time. Probably should have. EDTA chelation, we usually give it intravenously with a lot of other nutrients to help open up circulation and slow down dementia. And it will reduce the need for bypass surgery and stenting in some people with coronary artery disease. And it'll reduce the need for amputations, especially in diabetics. So EDTA chelation is wonderful stuff, and it can be given, of course, intravenously, but also it can be done orally along with lipoic acid and garlic and other chelating agents. And it can be given by suppository, rectally, and also by transdermally by a topical cream. So EDTA can be gotten into the body in many, many ways. And again, we find these heavy metals and mercury and lead, especially a lot in mine workers and people that are doing assays for heavy metals in the laboratories in mines. Now, there are many chelating agents, and for mercury, we really like to use the chelating agents of DMPS and DMSA, dimercaptosuccinate, and dimercaptopropane succinate. And these have been long used in Germany and usually are given, can be given orally, and especially are good for mercury. Also for mercury is humic and fulvic acid, which is zeolite. It's a clay. It makes a chelate, and it goes especially well after mercury. And it's been used for thousands of years in India. It's called Selagit. And they would always say it would turn an 80-year-old man into a 16-year-old boy if he took a course of Selagit. And they even ran out of it in India, so they have to get it in Pakistan. So it can also do other heavy metals. Now the TAX study, which was the trial to assess chelation therapy, was completed in 2013 with, I believe, 1,700 people in the trial over 7 years, and 40 chelations were given, which is IV chelation therapy. They didn't change the diet, they didn't change the supplementation, and the criteria to get in the study were to have a heart attack or a stroke. And the endpoint of this study was a recurrent heart attack or a stroke or death. And after the 40 chelations, the average reduction in reoccurrence was 18%. But in diabetics, it was 49%. Because as we may know, that diabetics make bone in their arteries, why they are so apt to lose toes and feet and legs to hardening of the arteries. So this has been shown to be quite effective as an arterial opener. So the safety-wise, chelation is quite safe. You just have to have decent kidney functioning, and even at impaired kidney functioning. We're looking at the BUN and the creatinine and the estimated glomerular filtration rate. But it can be given at a quarter dose or a half dose, and then frequently it'll improve kidney functioning. So that's the only downside. And we always like to do the hair analysis first to see the heavy metal load. Now, aluminum is another very common heavy metal, and it can be in hair products and, of course, in cans, and bottles, aluminum cans. So trying to avoid aluminum. Of course, one of the great sources of aluminum is table salt, regular table salt. The little guy with the umbrella, it pours when it rains because it's got aluminum in there as a drying agent. And aluminum, as we know, is related to Alzheimer's disease and also to autism. So in trying to avoid aluminum is another good thing. Aluminum is chelated out of the body by several different agents, but particularly in apple juice and apple cider vinegar and red wine vinegar and red wine, actually. So by the chelation process has been known in regular chemistry for hundreds of years, but in humans it's really important, especially in our modern ages, as we are exposed to lead. And many people in law enforcement say, oh yes, I remember the range officer at our local shooting range died of lead poisoning. So this is unnecessary these days, as we can pull lead and cadmium and arsenic and aluminum and tin and nickel. And uranium is another radioactive heavy metal that's found a lot in these areas, and uranium comes out of the granite. So when water runs through granite, people get uranium. And at certain mid-range levels, it can cause chronic fatigue. And uranium can be brought out of the water supply by reverse osmosis filtration, which is a fairly easy way to get rid of heavy metals. So we do routine hair analysis and then also 6-hour challenge testing for heavy metals after an IV infusion of EDTA. So good old chelation has been around a long time, and I've been doing it for 43 years. And I first started when I was 31, and all my family had a lot of Alzheimer's people that didn't know anybody the last 10 years of their life. And after my first chelation, my brain brightened right up, and I said, oh, this is why people like chelation, because it really opens up their psyche and their brain power. So chelation is great, avoiding calcium is great, up-to-date cancer therapies. There's wonderful homeopathic therapies. So in the integrative medicine in the C department is full of wonderful findings. So we hope you will get to know more of these guys and keep tuned in to the Medicine Wheel podcast. And I am Dr. Michael Gerber. Have a great day.
The Medicine Wheel encourages all of our listeners to subscribe to our newsletter and podcasts as we continue to explore the world of medicine, bringing you up-to-date health and science information. The Medicine Wheel invites our listeners to email us any newsworthy stories or topics they wish to explore further and discuss on the podcast. For more information about the Medicine Wheel, please visit us at our website, www.themedicinewheel.org, and on Facebook, and finally on Twitter and Instagram at The Med Wheel.
In an effort to support access to integrative medicine and functional medicine options for those in need and education for those who need information, please consider donating to Project OmCare, 501c3.org. Please go to our website, www.themedicinewheel.org, to learn more.
Thank you again to all our local sponsors, Grateful Gardens, Lighthouse Coffee, and Dorinda's Chocolates, which represent some of the best organic and appetizing options in the Reno, Tahoe area.
Lighthouse Coffee Shop is a proud sponsor of the Medicine Wheel. We are a family-owned and operated local coffee shop. Our goal as a business and a family is to cultivate community wherever we are. All of our coffee is ethically sourced, organic, and farm fresh. It's roasted in-house daily, guaranteeing you access to the freshest cup of coffee on the planet. We care deeply for our community and everyone in it. We strive to provide you with the best ingredients and most comfortable environment. Come and enjoy coffee with us. We are family, and we would love for you to be part of it.
Gerber Medical Clinic is proud to support the Medicine Wheel and medical education to improve health quality, nurturing the lifestyles of our listening community, enhancing wellness for all. Thanks again to Wired Insights and their talented team for making our podcasting dream possible.
In closing, we would like to remind all of our listeners, if you have a medical concern or diagnosis, you need to see your personal doctor without delay, and if needed, obtain a referral to a specialist. If ever you feel the health issue you have is urgent or an emergency, please call 911 and go to your nearest emergency room. Please do not take any of our physicians' commentary or our guests' opinion as medical advice, and always seek out medical care from fully licensed and appropriately trained medical professionals in your area. The information shared in this podcast is for general information only and should not be construed as medical advice, and understand that no doctor-patient relationship is formed. The use of this information and educational materials linked to this podcast and website are employed at the user's own risk. The content of this podcast is not meant to be used as a substitute for medical advice, diagnosis, or treatment.
This is the Medicine Wheel signing off for this week with a reminder to live, love, listen, and learn.